Makerere University School of Public Health is one of the 7 schools in East and Central Africa forming the AfricaHub project. The project is supported by the Future Health Systems Consortium to implement a 5-year project that aims at building the capacity of health systems research. This will improve health systems performance and access to quality research for policymakers and other stakeholders to make informed policies and facilitate implementation of decisions.
Health systems research, first of all, is research that is relevant to policy and practice. So under AfricaHub, we are trying to build this kind of capacity in the different schools.
What we realize is that if we are going to improve health systems performance, if we are going to improve policy making processes, you need evidence, you need research.
The project is building the capacity of students in the field of health to carry out quality research and disseminate their findings to the relevant stakeholders. The school has assigned mentors to aid the students during tool formulation, data collection and dissemination.
Those graduates who are doing masters, they are attached to the district so that they can identify challenges within the district with the help of the DHT, so that they can do their short studies, like what Philip did, and then come back and disseminate so that we can be able to use the findings that are evidence-based.
This year, 2 students, Philip Wanduru and Lydia Nakire, have been supported to carry out research in different fields in Lira and Kabarole districts.
I did a study to assess the availability of commodities and infrastructure of family planning in health facilities in Lira. Very few women have access to family planning, despite the fact that they need these services. Only 60% of women in Lira who need family planning have access to it.
The study found that 40% of women cannot access family planning services in the sampled health facilities within Lira municipality. The study provides key recommendations to the stakeholders if universal access to family planning commodities is to be achieved.
Were encouraging them to increase their choice, the variety of family planning commodities that they give to the clients. This will help reduce this access issue. It will help encourage more women to use family planning.
Access to family planning commodities will accord women equal opportunities with men and empower them to have planned pregnancies and number of children they want, leading to improved quality of life in the households. Lydia researched on male partner involvement in prevention of mother-to-child transmission of HIV.
Male involvement in PMTCT is key to maternal and newborn health. Studies have found that male involvement in PMTCT has several benefits, among which we have improving of breastfeeding among the newborns. Then we also have improved uptake of ARVs among HIV positive mothers. Then we also have improvement of communication between couples once the partners are involved in PMTCT.
The research makes key recommendations which include During the dissemination of the findings by the 2 researchers to stakeholders, participants were happy to access credible information in the 2 health fields for the first time.
I want to appreciate the School of Public Health, Makerere, for the great work they have done especially in conducting this research. And the local government prioritizes their budget in line with what the government gives, the central government gives. So with this report, I believe that you help them come with a strong health strategy. And of course, the ministry will pick up from what they were stopping.
Things which we didn't know, now the research has brought it. We've known through this research, and we promise to implement whatever new things that have come across.
Now, in its 4th year of implementation, the project has registered several achievements.
We've contributed to building the library in a box, which is a storage place that brings together all the research that is taking place in health systems research. We've structured this according to different health systems building blocks. So you can go in there, it's online, you can go in there and get all the research that has been produced in health systems research. And then the other thing that we've done is support now about 4 students to disseminate their results over this period of 4 years. And then we also did an assessment of the capacity of the school. That was the first thing that we did. And through that, we have been able to fill in some of the gaps. One of the ways that we've done that is we've organized some workshops, and people have come in to give different kind of talks about health systems research. And lastly, what we have also been able to do is, perhaps most importantly for a teaching institution like Makerere University, is to develop the short course in health systems research, which we believe is going to be embedded within the school and will be running annually, and will channel out students who will have been mentored and trained.
Despite these achievements, health systems research is still a new area. There is need to continue building the capacity of the researchers to generate more information.
There are still many gaps that exist, particularly methods for health systems research. People are still very much attuned to epidemiological kind of research, and so what we need to do right now is try and build a critical mass of people who can identify a research question in health systems research and apply the appropriate research methods, and therefore channel out relevant research findings.
Capacity building, increased health systems research, and dissemination of findings will enable stakeholders within the country to build a more sustainable and responsive health system meeting the needs of the people through evidence-based planning.
Moving forward, we might be able to change the focus of AfricaHub to see it more embedded within the institutions, and see that we have more mentoring, for instance, for students. We have more mentoring for junior staff vis-a-vis the senior staff, and see that we have a collaboration across different disciplines within the schools. As you might realize, health systems research is interdisciplinary, and therefore we need to have different kinds of disciplines bringing their energies together on the same table.
We are thinking about building capacity for even a broader community, including policymakers, including the media. And so we've structured a couple of training workshops, short courses, but also high-level courses going forward, so that we can begin to build really a movement of researchers, a movement of advocates, a movement of communicators that are able to reach out to the policymakers and tell them, hey, we need to change the system.